Coronavirus or COVID-19 and protection. This video is for informational purposes only. It is not to be substituted for professional medical advice. Please consult a doctor for further advice. What is a coronavirus? Coronaviruses are a large family of viruses which may cause illnesses in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS), Severe Acute Respiratory Syndrome (SARS), and the most recently discovered coronavirus disease called COVID-19. What is COVID-19? COVID-19 is an infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. COVID-19 is now a pandemic affecting many countries globally. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and breathlessness. Other symptoms that are less common and which may affect some patients are aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, rashes on skin, or discoloration of fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected but will only have very mild symptoms. Recovery rate. About 80% who have contracted the COVID-19 recover from the disease without needing hospital treatment. Around 1 out of every 5 people who get COVID-19 become seriously ill and develop difficulty in breathing. Older people and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes or cancer are at higher risk of developing serious illness. However, anyone can catch COVID-19 and become seriously ill. Medical attention. People of all ages should seek medical attention immediately if they experience fever and/or cough associated with difficulty in breathing or shortness of breath, chest pain or pressure, loss of speech or movement. It is recommended to call the healthcare provider or the coronavirus care facility first so the patient can be directed to the right clinic. How does COVID-19 spread? Point 1. People can catch COVID-19 from others who have the virus. Point 2. The disease spreads primarily from person to person through small droplets from the nose or mouth. Point 3. These droplets are expelled when a person with COVID-19 coughs, sneezes, or speaks. Point 4. People can catch COVID-19 if they breathe in these droplets from a person infected with the virus. Point 5. These droplets can land on objects and surfaces around the person such as tables, doorknobs and handrails. Point 6. People can become infected by touching these objects or surfaces, then touching their eyes, nose or mouth. How to protect and prevent the spread of disease? You can reduce the chances of being infected or spreading COVID-19 by taking a few simple precautions which are representative of below 9 ways. Point 1. Regularly and thoroughly wash hands with soap and water or clean your hands with an alcohol-based hand rub. Why? Washing your hands with soap and water or using alcohol-based hand rub kills all the viruses that may be on your hands. Point 2. Maintain at least 1 meter distance between yourself and others. Why? When someone coughs, sneezes or speaks, they spray small liquid droplets from their nose or mouth which may contain virus. If you're too close, you can breathe in the droplets including the COVID-19 virus if the person has the disease. Point 3. Avoid going to crowded places. Why? You're more likely to come into close contact with someone that has COVID-19 in a crowd, and it is difficult to maintain a physical distance of 1 meter. Point 4. Avoid touching eyes, nose and mouth. Why? Hands touch many virus contaminated surfaces and can transfer the virus through your eyes, nose or mouth and infect you. Point 5. Follow good respiratory hygiene. This means cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately and wash your hands. Why? Droplets spread viruses. By following good respiratory hygiene, you protect the people around you from various viruses such as cold, flu and COVID-19. Point 6. Wear simple homemade masks when physical distancing is not possible. Why? Close contact with people with suspected or confirmed COVID-19 and their surrounding environment are the main routes of transmission. Point 7. Stay home and self-isolate if you have even minor symptoms such as cough, headache, mild fever until you recover. Have someone bring you supplies. If you need to leave your house, wear a mask to avoid infecting others. Why? Avoiding contact with others will protect them from possible COVID-19 and other viruses. Point 8. If you have a fever, cough and difficulty in breathing, seek medical attention, but call by telephone in advance if possible and follow the directions of your local health authority. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of viruses and other infections. Point 9. Keep up to date on the latest information from trusted sources such as your local and national health authorities. Why? The local and national authorities are best placed to advise on what people in your area should be doing to protect themselves. The most effective ways to protect yourself and others against COVID-19 are to clean your hands thoroughly and frequently. Avoid touching your eyes, mouth and nose. Cover your cough with the bend of elbow or tissue. If a tissue is used, discard it immediately and wash your hands. Maintain a distance of at least 1 meter from others.
Stay informed, stay healthy, stay connected.